Hey everyone, OT Lifehacker here with OT 101. Yay! Okay, so we are going to be talking about Certified Occupational Therapists, Therapy Assistants, so COTA, and Occupational Therapists. And this is just going to be our intro video, the key takeaways that I learned from, where am I? A lecture that I attended on occupational therapists and COTA. And so I am a student in occupational therapy. So disclaimer, I am still learning, still getting my feet wet out in the field. I am telling you what I've learned from this lecture in combination with what I've learned from my classes, coursework, and books that I have read. So I am so interested to know how you guys have done it in the field, what your experience is like on the floors, in the hospital, in schools, wherever you work. What is your experience like when working with a COTA, an OT, or a whole bunch of them? Because we are here to learn from each other. So the key takeaways that I've gotten from today is collaboration is the utmost important. Whether you're a new grad coming in, been in the field for many years of experience, a key to the relationship working out is collaboration between the two parties. And that your goals, always remember that your goals are to help build each other's skills and competencies. Because when you are growing, when you are feeling that just right challenge in your knowledge and feeling motivated to keep learning and keep doing what you do, you're gonna love your work so much better and be even more driven towards your goal of helping the clients succeed, giving the utmost, as best effective as you can, care to your clients. When you're wanting to learn an assessment, you're a COTA, you want to learn an assessment, ask the OT if you can do it. And both of you can collaboratively decide, okay, what's the most appropriate approach here for me learning this, for me growing my own skills. It is, as the guest lecturer today said, it's like a marriage. In fact, you might even see your partner in crime in the hospital or whatever field you're in, your COTA, your OT, more often than you may see your partner at home. And that the relationships, the skills that you use in practice and at home for building relationships, it's not that different. I mean, granted, your goals are a little different, but you're still always having that communication and that trust, building rapport, and just relying on each other, having this independent sort of relationship, this give and take, mutual respect, all of that. It's not different. So, practice at home, then practice at work, and then you'll get the best of both worlds. I don't know about that, comment below. But hopefully. Okay, and that it's a complex alliance. So again, it always goes back to the relationship between you two and how it forms, how to best foster that relationship. It's a complex alliance. You need to have best practice in what works for the both of you. And so basically what you should take away from all of this is it's a collaborative relationship. Nothing is black and white. It's dynamic. You won't know how to do something well from just the books that you learned. You go out there, a new therapist, a new assistant, you go out there, you may have all the knowledge you have, but you can come in and be like, okay, so when should we schedule our meetings together? How do you want to work this out? The OT or the COTA might be like, oh, that's not how we work, or what the heck's happening here? Because you have to go with the flow of things. If they look pretty chill, hey, you chill out and be like, okay, so how's this work? And then, you work with what works for you both. But just know that it's pretty much go with the flow of what you see in the other person, what works for them, and figure out a common ground between you two. All right. So, because again, key points, Your goal is to help the client succeed. And through that, you keep growing. You keep your drive to do what you love, which is very likely continuously learning so that you can be a better therapist, a better assistant. Thank you all so much for watching, and this is just the summary of what I've learned today. You're gonna have so many more videos coming soon on the knit and grit of what I learned today, from how to foster that relationship, and what are the role delineations between OT and COTA, and how do you designate who does what. So all of those are going to be in next videos. Please stay tuned. If you're interested in this, in OT 101 information, the deets on what OT does, please subscribe and comment below. That is so important for us all to learn from each other. And share this video with anyone else, and whoop, whoop, thumbs up all around. Thanks guys. Bye-bye.